Welcome back, beautiful people. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I'm your host, Zen Sams. Now, we'll be chatting minerals, supplements, and COVID 19 with Dr. Jeffrey Galvin of Vitality Medical Institute. But first, a big shout out to Aikido Pharma and CEO Anthony Hayes. They have just recently joined the sponsor lineup. They're going to be debuting with this segment called My Healthy Minutes. Now, Aikido Pharma is an early stage drug development company dedicated to developing new solutions for life-threatening diseases. Aikido Pharma publicly trades on the NASDAQ under ticker symbol AIKI. Now, as the world grapples with the COVID-19 pandemic and the lack of clinically effective therapies, attention is shifting to different ways of strengthening the immune system. We know that COVID-19 infection considerably impacts our immune system through multiple inflammatory responses. Now, a balanced diet that includes vitamins A, B, C, D, E, and K, and micronutrients such as sodium, zinc, potassium, chloride, calcium, and phosphorus may help maintain general well-being and strengthen the immune system and logically decrease infections. A deficiency of vitamins and minerals in the plasma leads to subpar performance of the immune system, leading to a poor immune state. And as my mom research points to recent evidence showing that nutritional supplementation does help reduce viral load and hospitalization rates. Furthermore, mineral supplementation has been shown to positively impact immunity in viral infections and prevent and reduce cardiovascular and cerebrovascular diseases, which are features of severe COVID-19. Now, which supplements can we use? Well, Dr. Jeffrey Galvin is joining us right now to break it all down. He's an internal medicine specialist with more than 31 years of experience. He is the founder of Vitality Medical Institute, which is an executive medical boutique specializing in optimizing health and performance. They help reverse chronic disease, optimize hormonal health, improve body composition, and weight loss. Welcome to the show, great doctor.
Thank you very much, Zen. Little correction, I'm actually board certified in emergency medicine. And so besides running my clinic, I still work in the emergency department. I've been working throughout COVID. So I have a little bit of a personal, background with COVID and have seen all the havoc that it's caused. And we're here in North Carolina and we're dealing with a big surge right now. It's really not really made it up to New York yet, but it's probably coming. And so we are always talking to our patients about how do we minimize risk, right? And so we want to avoid getting COVID and we want to do the things that are going to mitigate things, take mitigation strategies, avoid going around people who are sick, distancing, all the things that we've been kind of pushing. But are there some other things that you can potentially do in addition to that that might boost your immune system? Now, our practice is very much data-driven and evidence-driven. So we don't just make, recommendations willy-nilly. We try to look at the science. And since this started, we've been doing podcasts and webcasts since the beginning. And back in April of 2020, I put together a supplement guide that has been updated from time to time as more research has come in. And I think we'll talk about some of those supplements that you can add to your current regimen that potentially can reduce your risk of getting COVID, or if you do get it, maybe get a much more minor case of it than you might get otherwise.
Got it. So which specifically vitamins do you recommend to help our bodies fight COVID-19? And again, back to your commentary, I mean, COVID studies show that, long-term mineral deficiency may lead to an increase in some of these levels, ACE2 levels in lower respiratory tract cells, which in turn could increase the severity of COVID-19. Now, which minerals would you say we should stick to, and vitamins, if you can sum it up to the general public walking into the regular GNC?
So, I think the first one that we start with everybody is vitamin D, because Americans are notoriously vitamin D deficient. Normally we would produce vitamin D from the sunshine, but if you live in the South and if it's really warm in the North, we aren't outside like we used to be. We are inside, and so vitamin D levels are low. And also the national sort of guidelines for vitamin D are, in my opinion, very, very much too low. I think 30 is considered normal. We really want people between the level of 70 and 90, and your doctor can check that. But vitamin D is really important. It's actually a hormone. It's not only a vitamin. And we know that it has a profound effect on immunity. It has a lot of other really great benefits in terms of cardiovascular health, vascular health, brain health. But we think it can reduce cytokine storm. There's plenty of studies that have been done in hospitalized COVID patients that show reduced admissions to the ICU utilizing vitamin D. And for a lot of people that are in the hospital with COVID, vitamin D is one of the mainstays of our current therapies. It reduces that cytokine storm. And I'm sure your listeners have probably heard of that cytokine storm, which is that sort of overwhelming inflammatory response, which oftentimes leads to people getting very ill or dying of COVID. And we think that vitamin D plays a role in moderating that cytokine storm. And so generally we tell people about 5,000 units a day, probably 3 to 5. You might, double check with your doctor depending on what your levels are. Vitamin D3 is the best available. And it's easy, it's inexpensive, it's very cheap insurance, and it has a lot of other benefits that you get. In addition, I would recommend taking it. Anyway, if you're outside a lot, maybe in the summertime you don't need as much, but in the wintertime, definitely you need to be getting it.
And what is the age range for people to be taking this supplement? Is it teens over 16 and up? What age range do you recommend specifically for these supplements, or is it overall?
I mean, I think that, for our purposes and the purpose of our patients, I'm mainly talking about adults 18 and over, although there are child doses of vitamin D that I would certainly recommend. I would probably ask people to ask their pediatrician about specific dosaging for their kids, because it really is weight based and it depends on their age and how big they are. And I don't want to, give anybody the wrong information.
Yeah, understood. And what about minerals? I mean, is there some minerals that are accessible to us over the counter that can help again prevent some of the more harsher effects of COVID, so to speak?
Yeah, absolutely. One of the ones that has been well studied and I think has got decent data to support is zinc. And zinc is a charged molecule. It's got a +2 charge. And the problem with zinc is that it doesn't get into the cell very easily because of that charge. If it's in the cell, it hampers viral replication. So if you're infected with a virus, not only COVID, but many other viruses, then what it will do is it will interfere with the ability for the virus to replicate. If it can't replicate as well, it's not going to make you as sick. But the problem is that it doesn't easily go into the cell. You really need something to transport that zinc into the cell. And in that case, we need basically what's called an ionophore, which basically, grabs that zinc and then that gets pulled into the cell along with the molecule because it sort of negates the charge. The one that is easiest to access and also, again, has a lot of other benefits is quercetin. And quercetin is a flavonoid. It's found in fruits and vegetables. And it basically has some unique properties. It can improve mental and physical performance, but also it acts as this ionophore. So if you take it along with zinc, you can get the zinc to get into the cells, and it's inside the cell, not floating around in your plasma, that it provides its benefit. Now, you can get into trouble with zinc if you take too much, and I think the recommendation is no more than 40 milligrams daily. And if you're going to be taking it for more than a couple months, you really need to talk to your doctor. But that's a general recommendation. Quercetin, we typically say about 250 milligrams a day. Now, in our protocol that we send out, and I'm glad to send it to your listeners if they would like it, we also have protocols for what to take if you actually have an active case of COVID as well. And then the dosages and the frequencies change a little bit.
Got it. Got it. So, it's all that fine balance. And of course, consult physicians and never, go out there and just start taking supplements and vitamins, without checking labels and whatnot. But we do know that, of course, this is proven fact, and there's a lot of data and statistical evidence that points to how beneficial minerals and supplements are. Now, we also know in the United States that in the United States, the highly transmissible Delta variant is driving an uptick in these COVID cases. And you're saying primarily among the unvaccinated, according to our conversation a few days ago.
Oh,
But the good news, right, is that that as the weeks pass, more reports have been coming out about the effectiveness of the vaccines that are in use and the potential of those still in development. So how do they differ, right? That was my question to you on our prep call. But it's important to keep up, but it's a daunting task, Dr. Galvin. And I'm going to say that given the flood of information and, of course, misinformation that's basically coming at us in so many directions, people are kind of confused about these main three vaccines. So we know that we have vaccines from Pfizer, BioNTech, Moderna, and Johnson & Johnson that are currently being administered. If I'm correct, those three vaccines are authorized by the FDA, right?
In the U.S., yes.
In the U.S., correct. Now, we know that the Pfizer is recommended for anyone 12 and older, and that the vaccine is being studied in children ages 5 to 11 currently. Moderna is also another one. But you told me something quite interesting about the Johnson & Johnson. Unlike the Pfizer and Moderna vaccines, you said it was a carrier or a virus vector vaccine. What does this mean?
The Moderna and the Pfizer vaccines are mRNA vaccines. And what they do is they basically carry this little instruction to build something. And that instruction is to build the spike protein of the virus. And when we have that, we have these antibodies against that spike protein floating around in our circulation. And if we get exposed, the virus seeds our mucous membrane. So none of these vaccines prevent you from getting sick, but when people get sick, it's from when the virus crosses into the bloodstream. And that's where you get clotting problems and deep lung tissue problems. And having taken care of hundreds and hundreds of COVID patients now and really dealing with another huge crush of COVID patients, what are we seeing? Overwhelmingly, they're unimmunized. The few breakthrough cases we've seen with the vaccine have been very mild. They don't need to be admitted. But the Johnson & Johnson is an adenovirus vaccine, which is more of a traditional vaccine where they've programmed a virus to infect the cells, and that virus tells the cells to start making this spike protein. Probably not, looks a little bit hard to tell, but it doesn't look to be quite as effective, especially against Delta, as Moderna and Pfizer. And so my recommendation for most people is Moderna and Pfizer, if you have.
Got it. Yeah, I mean, I think it's because the average person hears about the Johnson & Johnson as a single dose and that they don't have to go back, and they figure, hey, this is easier. But to your point, you have to look under the hood. It's not everything that glitters is gold, even in science. And we're at about a minute and a half coming to an end of this awesome segment. You are so knowledgeable, and I could just pick your brain for another 30 minutes, but we're definitely going to have you back. And if people can go to your website, obviously it's called VitalityMWI.com, Vitality Medical Wellness Institute. You're also on Instagram at VitalityMWI. And you also have a YouTube channel. Quickly tell us about that.
Well, from the very beginning, I got a lot of crazy questions about COVID. And one morning early on, I came out of a shift and had 1,000 texts. And I posted a little video, got many, many views. And so I've been posting about COVID pretty regularly ever since. And we've gotten into a little controversy lately because I did a rebuttal of Dr. Stock's comments to the school board in Indiana and an analysis of the papers, and that's gotten us, a lot of haters and a lot of support.
There's going to be lots of haters.
So,
well, yes. Thank you so much for coming on. This was awesome. We're definitely going to have you back. You definitely have to check out Dr. Jeffrey Galvin of Vitality Medical Wellness. I am your host, Zen Sams. You're listening to A Moment of Zen right here on 710 WR, the voice of New York. We'll be right back after this.